webinar. We're absolutely thrilled to have you all here with us today. In this session, we'll be sharing key insights about Canterbury Christ Church University, which is also known as CCCU. And we'll be focusing particularly on some of their popular programs in public health and physiotherapy. For those who may not be familiar with the university, a quick and brief introduction. Canterbury Christ Church University is a well-known and well-established public university in UK. It's located in the historic city of Canterbury in Kent. The university has a strong reputation for health, well-being, and a professional practice program. And it is particularly known for producing graduates who are ready to make a real impact in the healthcare and community well-being. So today we'll explore the incredible opportunities that you all will have studying in the UK and can offer international students the opportunity to explore. Before we begin, I would like to take you all through some housekeeping rules. I'd like to mention that this session is being recorded and the recording will be shared with everyone who is registered for the webinar. So if you have any questions at any point during the session, feel free to drop them into the Q&A box, which is there down, and we'll be happy to address them during the session or towards the end with our expert speakers who are present today. So to get us started, let me briefly introduce myself first. My name is Neha Shetty, and I serve as the Regional Director for Inuni UK, where I oversee operations across South Asia. And it's a pleasure to be hosting today with a fantastic group of speakers, and I'm looking forward to what they have to say about the opportunities that you all have to avail with us. So joining me today, we have an excellent panel of speakers who will be sharing their expertise and insights about these programs. So we have Marie Allen, who is a senior lecturer in public health, who will be speaking about the BSc Public Health program. We also have with us Nicole Holt, principal lecturer in public health and well-being, who will be introducing us with the MSc Global Public Health program. We have with us St. Borland, who is the senior lecturer in physiotherapy, who will discuss both the BSc and MSc physiotherapy programs. And last but not the least, we also have an international student ambassador with us, who is Pooja Rawat, who will share insights from a student perspective. So welcome, everyone. Thank you so much for joining in. It's a pleasure to have all of you here today. So today we will be highlighting some of our fantastic programs offered at Canterbury Christ Church University, which is BSc Public Health, MSc Global Public Health, BSc Physiotherapy, and MSc Physiotherapy. And these programs are designed to prepare students for impactful careers in healthcare, community well-being, and global health leadership. So let us begin exploring the BSc in Public Health program. To tell us more about this course, I'd now like to invite Marie Allen, senior lecturer in public health at Canterbury Christ Church University. Marie, over to you.
Thank you, Neha. Good morning, good afternoon to everybody on the call. So just to introduce myself, I'm the course director for the BSc Honours degree in public health here at Canterbury Christ Church University. Just going to talk briefly, because I know we're a little bit pushed for time to cover all these courses, but just to give you a bit of an oversight of the course. So this is a course that's been running a long time at Christ Church under various guises. So we're just going through what they call a revalidation process, which every few years we just update our courses to make sure everything is current, reflecting the current situation around health just within the UK and globally. So in September of this year, 2026, we'll just be launching a new course. So the overview you can see on the screen, I'll just run through that briefly in a moment. But just to be aware that this has been an updated course looking at all the sort of changes globally and nationally from a political and environmental point of view, just to make sure everything is as up to date as it possibly can be in terms of the relevance of our course in terms of then getting graduate jobs at the end of it. So we're moving into the new Christ Church academic framework from September, slightly different framework to in previous years, but it's designed to also engage with some wider university learning across many different pathways. So the first point from a public health perspective, we're very much looking at how we influence health individually, in a community basis, nationally and globally. So we have that sort of thought process of we think globally, think locally, but act globally. So we're looking at the pivots, the central concepts of public health around health promotion, health protection, and the prevention of ill health. So those pivots, those central components run throughout all of our modules throughout the 3 years of our undergrad course. And we also look at how health behaviour is shaped. So we'll look at elements around health behaviour, science, including psychology and sociology. We look at how that influences individual health, and how that in turn can influence community and national and international health. We also look at how that influences public policy around health. So we tend to focus, first of all, on the UK, but also widen that perspective out to a global level. So we'll be looking very much at UN Sustainable Development Goals, WHO, World Health Organization components of health, as well as UK policy. So one of the things that's come from students' feedback in recent years is the desire to be linking in with real public health challenges. So we're widening the remit of the courses we deliver to make sure that we've got a strong link to research within the team, but also how we link in with wider public health workforce. So we have a number of people, including former graduates of ours that work in industry, that come back and speak as part of the team and introduce those real world challenges that they're faced with. And within the team, both at undergraduate and postgraduate level, we have a lot of active researchers who are researching around public health, both within the UK and globally. So we have a really strong internal research remit, and that impacts and reflects on our teaching throughout all of our modules. So students that are coming onto our undergraduate course, there's many modules that form the 3 years, but they'll learn communication skills digitally and verbally. They'll learn about the structure of health organisations, which will help improve their leadership capabilities. We touch on elements of research at various modules and through a dissertation in the final year, so that improves people's research skills, which again could be linked strongly to progressing to postgraduate study later on. In terms of careers, one of the, to my mind, the real strength around public health is that there are so many careers that this opens people's doors to. So it's not a restricted course. It's not that you just automatically become a public health officer, for example, at the end of the course. There's many areas of health services, the National Health Service in the UK and wider international health. Public health in this country is delivered through local authorities, so there's a lot of routes into local authority work, charitable organisations, non-governmental organisations, really a really wide sector that actually has a wider public health workforce. And also from the end of the degree, we have a good number of students that then pursue master's studies within the university, not just with public health, but in other health-related courses. And many of those students, as I say, have often come back to us as alumni to work with our current students and looking forward into industry and present some of the challenges and practical examples back to our undergrad students. So, sorry, that was a whistle-stop tour, trying to say as much as I can in a short space of time without taking too much everybody else's time. So I'm obviously happy to take questions later on.
Thank you so much, Murray. I think that was a very insightful overview, and I'm sure you're going to have a lot of questions towards the end. So now let's move on to the next slide, please. So yes, we do have the MSc Global Public Health program. And to guide us through this course and what students can expect from it, I'd now like to invite Nicole Holt, who is a principal lecturer in public health and well-being. Nicole, the floor is yours.
Thank you. Hello, everybody. It's so lovely to meet you all. I'm Dr. Nicole Holt, and I also, as well as being the Principal Lecturer in Public Health and Wellbeing, I am the Course Director of the MSc Global Public Health, which is a course that I'm incredibly proud of about. And just building basically on what Murray said, so what we do at Christ Church is that we tend to teach to our specialism. So for example, me and Murray do health promotion because that's our area of expertise. I'm an expert in social prescribing, so I'm very interested in community-based assets. And we have things like Steph, who is Dr. Stephanie, who is an expert in epidemiology, and that's one of our modules on our new MSc Global Public Health course. And the whole point of this Global Public Health Masters is to take a really good interdisciplinary approach to understanding and addressing some of the big global public health issues and challenges. And we're very lucky on our course because we have students from such a wide range of backgrounds. Like Murray was saying, lots and lots of different types of people do public health. So we have things like doctors, vets, dentists, occupational therapists, lawyers, people who have business degrees, all sorts of bits and pieces. And we're very lucky because today the student ambassador is one of my lovely students, which I'm really proud about. And I'll come on to her in a second and she'll introduce herself. But the course offers a lot of different routes and pathways. Some people use this to go onto the public health register in the UK. Our students, like Murray said, do lots of different types of jobs after they finish. And I think sometimes for them, it's not just studying at Christ Church, it's part of their journey. And what we are really good at teaching is critical thinking and critical skills. So we really make people challenge their beliefs, which I think lots of students find really helpful. We talk a lot about health inequalities. We talk about epidemiology and how diseases spread. And we do lots about health promotion and talking about things like healthy settings. And part of the MSc Global Public Health is you also get to do a research project as well. So whatever your area of interest is, we give you a supervisor and we support you through that journey. And you look at basically your topic. And today I have my lovely student rep here. Would you like to add some things in, Pooja?
Yes, I would say that MSc Global Public Health and the team at Christ Church is like really good, and the professors we have, they are like really specialist at their modules. And the thing which I really like about our specific course is that our teachers are very open about any questions that you have. Every and any question is accepted, and we are taught like basically from the best people. Yeah.
That's so kind. And you make really good connections in your own group and classes as well. And something that we're really proud about, and this is true for the undergraduate and postgrad, is that we give you a personal academic tutor. And that person is one person to support you throughout your whole journey. And they're an academic that are there to talk to you about writing, any personal problems, and just basically if you want somebody to chat to or a catch up. And going back to career-wise, lots of our students do very different things. So, for example, I've got one student who's gone to work for the World Health Organization. Lots of our students go work for charities. Lots of them take their knowledge back home and go work for their governments of their home countries. And some stay and do social prescribing. Some of them stay and do public health practitioner jobs. And lots of my students also stay and do PhDs with me as well, which I love. Not that I'm pushing that, but yeah, you know, we love anything like that. We love studying, and we love supporting your journey and your experience as well. We're interested in what you're interested in. If you're a dentist and you're interested in public health and dentistry, you know, we're very interested in that. If you're a vet, whatever your expertise or your background is, we like to explore that further. But yeah, any questions, let me know at the end. Thank you so much. And sorry if I've taken up too much time.
No, that's absolutely all right. I think, thank you, Nicole. I think this was very informative, and it's great to see both Murray and you did focus a lot about the program on how it is designed and equip students with the practical skill set and the knowledge that they need to enter the workforce. So I think that was Super exciting. And thank you, Pooja, for adding in with the student experience that you have. Now, let's shift our focus to the next slide, which is BSc and MSc in physiotherapy programs. And I think this is a highly sought after field in for all the international students. So I'd like to invite ST Bolland, Senior Lecturer in Physiotherapy. ST, over to you.
Thank you so much, Neha. Thank you for this opportunity to present our courses as well. I want to also just say thank you to Murray and Nicole. Nicole, you've actually made me want to join your course now. So I would like to just draw attention to the fact that you can hear that English is not my first language. And I think that that is one of the biggest strengths that we have in our course team, is that we are a truly international bunch of teachers, that we have a good understanding of what is needed for a student when they come into this country as an international student. Just a little bit more about our team, because as I said, our team, teaching team, is actually one of the biggest strengths that we have within this course. The course has only been running since 2018, when it started with a BSc course. We now have also got a pre-registration MSc course. The biggest difference between the two is that we want you to come in with a previous degree in a health subject for the MSc. The content of the two courses, the BSc runs over 3 years, the MSc over 2 years. The content is the same. At the end of your 2 years in MSc or your end of your 3 years of BSc, we want a well-rounded physiotherapist who is ready to go into a job in the UK job market. Therefore, our course is scaffolded to teach you from level 4, your first year, through level 5 to level 6 in the BSc. Obviously, then in the MSc, it will be on a level 7. I think what we have, again, I'm going to come back to our team again, is that we have experts in all the core streams of physiotherapy. I myself am an MSK physiotherapist. We have got another MSK physiotherapist who has a PhD in back pain, which is actually a global health issue as well. Myself, my master's degree was also in lower back pain. We have got 2 people whose experience and expertise lie in the respiratory world. So, looking at, for instance, one of our staff members worked in ITU during COVID. So a lot of experience in terms of that. We also have some experts in the neurology field, pediatric as well as adult neurology. And one of our lecturers actually has a PhD as well in mental health, which is a growing area for us in physiotherapy as well. So lots of clinical background, but we also have a good strength in research. Our 2 professors in our school are both physiotherapists. The one is Professor of Interprofessional Learning, and then the other one of Clinical Learning. They both teach over both courses as well, and they help us out specifically with our research modules that we do have. Let me see. I've actually not spoken to this slide at all. So, a course overview, we scaffold your learning so that you learn to assess, diagnose, and then manage physical and movement-related conditions, but we do take into consideration the whole person. So, we teach you to be service user-centric. So it's not just about their body, and we follow what we call a biopsychosocial model of healthcare. So we look at the biomedical aspect of it, but we've realized within physiotherapy that looking after the person as a whole works much better. Okay. We develop your knowledge of rehabilitation injury prevention, and as I said, patient-centered care. And we follow also an initiative from the World Health Organization, where we need to be able to use in our what we call our toolbox, if we have anything that's curative for the patient, that we can actually do. But the focus is very much on rehabilitation, because there is a worldwide need for rehabilitation within physiotherapy. But we also look at what else must we do to make sure that this patient gets the right care. So we look at where can we refer the patient. So I love also the fact that Nicole said she likes this social prescribing, and in fact we actually include some of that in our course as well. But we look at should we send this patient back to their GP? We make sure that our students know when they need to send patients urgently to accident and emergency, or A&E, emergency wards, which is, by the way, not often that happens. But do we maybe need to send this patient to a diabetic nurse to help with what's going on in terms of their diabetes? So we look at the whole person. Something else that fits into that remit from the World Health Organization is also primary and secondary prevention. And this is where we need to teach our students in-depth understanding of how they are actually going to educate their patients, not just in regards to what their specific injury is, but also to their wider health needs. I'm so happy this slide also says that we combine academic study with clinical placements in healthcare. So our students have to complete a total of 1,000 hours of clinical placement, and these placements are assessed, and you have to pass all 1,000 hours of that. And that enables you then to register with the Health and Care Professions Council, which is our regulatory body within the UK. You'll also see that all of our lecturers are registered with the Health and Care Profession Council, and we're all chartered physiotherapists as well. So our physiotherapy union is called the Chartered Society of Physiotherapy. And in fact, on both of their websites, you'll find some really valuable information about physiotherapy in this country. Further on with the course overview, building skills in clinical reasoning, and we're very particular about that. And that's reflected also within the way that we assess our students on the course. We're very big on teamwork. We have specific modules where our students have to work in teams together to produce either a poster or a piece of research. And then we are very proud of the fact that we work evidence-based. So not only will our staff look at what is new in the world, but we actually get co-production going with our placement providers as well, to make sure that we incorporate into our course what they feel is new and exciting within physiotherapy. As a qualified physiotherapist, you can work in hospitals, in rehabilitation centers, sports organizations, community health care. There's also a lot of growth in terms of your own career going into leadership positions. Therefore, some of our placements that we do are actually alternate placements where we have a leadership placement, for instance. We've had really great feedback from our students in terms of what they've learned on there. There's a lot of further study available, lots of continued professional development that you can do attached to the Chartered Society of Physiotherapy, and other postgraduate courses. I would definitely look into doing a master's degree in global public health, for instance. And some students can even go on to study psychology. There's so much that you can do once you've actually got that physiotherapy degree. So the duration is 3 years, and it is full time. And I think this is something that I just want to bring to the attention of any prospective students, is that the program is very full. That you really will have to adapt your lifestyle to be sure that you use all the opportunities that are given to you here. I'm wondering if we can move on to the MSc Physio. And it really is the same, except that it's a 2 years program. I've said already that we expect our students to come in with a previous health degree already, because it is an MSc pre-registration master's degree. Right, I think that's it from me. Thank you for the time, Neha. Thank you.
Of course, I think thank you, ST. This was an insightful overview, very exciting. And I especially appreciated you highlighting the diversity within the university, because not only this is true among the student community, but also within the faculty. And I feel it's very welcoming for the students. So thank you so much for highlighting that. And absolutely, the international faculty and expert practitioners, I think, will help create a very supportive environment which will help them just not know what is there in the entire program, but also get a good industry knowledge. So thank you for sharing all of that. And I can see there are a lot of questions in the Q&A section, which we will get to shortly. But I first want to go through the entry requirements of these programs. So looking at, and I know everybody's covered a bit of it, but looking at the undergraduate requirements, students required to have first the completion of a recognized high school or a senior secondary qualification. And for English, for BSc Physiotherapy, we require IELTS 7.0 overall with no element below 6.5. Similarly, for BSc Public Health, the overall IELTS is 6.0 with no element below 5.5. Looking at the postgraduate requirements, students should hold a recognized bachelor's degree, preferably in a relevant discipline. So this is very important and crucial. But looking at the English requirement for MSc Global Public Health, IELTS is 6.0 overall with no band below 5.5. And MSc in Physiotherapy, IELTS is 7.0 overall with no element below 6.5. Also, I'd like to mention that our applications are open for the September 2026 intake, so students can submit their application through our Girls Gateway. Now it's time. So we'd love to hear from you. If you have any questions about the programs, the student experience, or studying in the UK, once again, please drop them into the Q&A box and we'll be happy to address them. So I'm going to be starting with taking a couple of questions. Okay, we begin with Pooja, because the first question is with the experience that you've had with Triple CU. So Pooja, question is, as a student currently studying this course at Triple CU, could you share what initially motivated you to choose this particular field?
Yeah, sure. So I would like to introduce myself. I am Pooja Rawat, and I am studying MSc Global Public Health at Christ Church University. I am also a student ambassador. So a little bit about my background. I have done MBBS in my undergrad course. So after completing MBBS, I realized that many of the patients that I treated during my clinical posting there were like conditions that could have been prevented with right support, and I really wanted to move beyond the stethoscope and prescriptions approach. So to explore the non-clinical side of healthcare, I decided to choose global public health at CCCU, and I was quite keen to learn like to keep people healthy in their daily lives so that they never have to become patients in first place.
That's amazing. Thank you so much for sharing that. I'm going to combine two questions, which is again for you, Pooja. So, what does your typical week look like as a student studying this course, and what do you enjoy the most about the classes with the learning experience that you have?
So if you're studying MSc full time, we have like 3 trimesters. It is divided into 3 trimesters, and depending on which trimester you are in, you will have face-to-face timetable. It usually spans like 3 to 4 days a week, and first and second trimester are often more lecture heavy as you build more foundations like in subject like epidemiology and research module. The third trimester is more basically it shift towards more intensive and independent learning. So it is more specialized project modules. We only study like research module in that. And outside of these 3 to 4 days on campus, you will have a significant portion of your week dedicated to individual learning. There will be a resource hub. You'll spend your time in CCCU Blackboard, which is a website where you can find like everything on your module, like all the lectures. The lectures will be recorded there as well, by chance if you miss the class. There will be curated learning. Your lectures will provide you specific reading material, research papers, and pre-recorded lectures, as I said before. And so there is like a basically collaborative gaps. You're not just studying in this course.
Absolutely. Thank you so much. I think this is great. Now, we've discussed a lot about the program, but we have one of the questions, which, again, for you, Pooja, is what would you advise or what advice would you give international students who are thinking about studying this course at Triple CU?
So I would say that keep an open mind because you are moving from a world of certainty and science into a world of behavior and society. So we have, if you are coming into this course, embrace epidemiology. It is the backbone of public health, and also lean into migration and culture topics because they provide empathy and needed for global work. And also, I would say, at the end, enjoy Canterbury. It is a peaceful place. So to transition into a new chapter for your career. So yes.
That's great. Thank you so much, Pooja. I'll get back to you. Now we have a question for Nicole. So, Nicole, the question is, how can international students strengthen their academic and research skills before starting courses like MSc Global Public Health?
Can I, before I answer that question, is it okay just to quickly answer the previous question as well?
Yes.
So if you were to ask me as the course director, you know, how to get students comfortable and starting out here is to live close to campus, really embrace university life. Like if you start the first, Pooja's nodding at me, like, and do the recommended reading, particularly the first few weeks when you start university is really important. And we have lots and lots of student union opportunities as well. So we have lots of clubs. Like, don't just meet students on public health, meet SD students, meet all of the different students in healthcare, because that is how you really build your networks and connections. And your question to me was how best to prepare. Sorry, was that the question? How best to prepare? No, what was the question? Sorry, I've forgotten.
Okay, I just answered that once again. Hold on. So the question is, how can international students strengthen their academic and research skills before starting courses like MSc Global Public Health?
I love this question. So a really good start is to see what's out there, what's in the news. I saw one of the questions is asked about what types of public health issues do we study, and it changes every year. So it's what's happening in the world of public health right now. So things like COVID, vaping. So seeing what's out there in the news is really important. You'll also see on the CCU website, we have a recommendation of reading list as well. And there's also books like the one, for example, called Study Skills. And is it okay if I pop it in the chat as an example? And that's a really good place to start, because one thing we notice about our international students is that they come very bright, but they don't always write in an academic way or how we perceive them to be in an academic way. So to get those skills up is really important. And I don't know if I'm allowed to say this, but I'm also Dr. Holt on TikTok. So if you want to start learning about public health and you like a quick, easy video, Dr. Holt on TikTok is a really good place to start as well. And I share lots of good advice and reading on there as well.
Perfect. Thank you so much for sharing that. We'll definitely follow you in there to get more information. Okay, now I would like to invite Marie, because we would like to understand how these courses align with the current global healthcare priorities and workforce demand.
Well, very good question. A little bit like Nicole just said, we react to situations as they go. So Nicole mentioned COVID, for example. Obviously, we can't escape that as a sort of public health emergency. Obviously, going into that academic year, we had no idea that we were going to adjust our teaching accordingly. So as matters arise, so we respond. So there are themes and patterns in public health, both nationally and globally. going back to, historically, look at, say, the 1980s and the rise of AIDS, that became a public health focus at that point. Cardiovascular disease was a big thing in the 1990s and the 2000s. It has moved right to obesity. So, there's always like a move through national and international needs that evolve, and so we respond to that. Also, I mentioned when I was doing my talk about the revalidation of courses, they're constantly monitored and changed to make sure we are responding to current situations, both within the UK and globally. So we move and respond accordingly to that. Something that Esty said about the international feel of her academic team, we have the same in the public health team. So our course, so our academics teach across both the undergrad and postgraduate. So we've got a lot of people from Ghana, from USA, from Germany, from Italy, as well as the UK. So we're kind of on the pulse of what's happening, not just locally, but we use that phrase of thinking locally, acting globally.
Amazing. Okay. Thank you for that. We also had a question on what are the subjects that would be required, Murray, for particularly getting into the program, any mandatory subjects that the students have to be prepared with?
Undergraduate level, no. So there are certain course requirements, particularly for professional registration, but we are working in the unregulated sector of public health. So the general country equivalents that we would ask for in terms of our UCAS, and on the slides earlier, we looked at the IELTS qualifications, that sort of thing. But there's no, I think because public health is very wide, we're not just focusing on physiology, for example, so we don't necessarily need people with biology, chemistry backgrounds, whatever people's previous background is, what they've studied at school of further education. If they're meeting the overall requirements, and it's non-specific for us.
Okay, fair enough. Thank you so much. I think let's look at this question for ST. Okay. For what type of healthcare settings do physiotherapy students typically experience during their placements? So the ROI question.
Yes, it's a very wide experience. So I think let's start with the NHS here in the UK. We do want our students to have as wide as possible experience. So we want them to experience an acute setting in a hospital, and that can be, for instance, in a trauma orthopedic ward where somebody has fallen and broken a hip. It can be in the ITU setting, or an ICU setting is also sometimes referred to. So people who perhaps are on a ventilator. So definitely that acute setting. We also look at rehab settings. So we'll do outpatients, MSK, for instance, where we can do follow-up rehabilitation with somebody who's had a knee replacement or a sporting injury. There is a huge drive for the to rather take healthcare to the people in the community as well. So we do send our students out on community placements as well. So it's also still within the NHS, but there are community NHS trusts. So you may because they are so excited. They've learned so much. They've had this opportunity to put into practice what we've been teaching them theoretically, and which they were only able to practice on one another. So it's such an exciting time, and we do a debrief with our students when they come back. So for each placement that you come back, we have a half a day debrief. And as I said, that's the most exciting time for the students also to compare how they've grown. Yeah. Thank you for that question, Neha.
Amazing. Okay, the next one's for you, Nicole, because I'm seeing very similar type of questions. So how can international students strengthen their academic and research skills before starting course like MSc Global Public Health?
So, like I was saying earlier, I've put some reading in the chat, but I don't think the chat goes live to everybody. So, is it okay to respond specifically to the question in the text?
You can do it on the box. It can go to everyone. I think in the
Okay.
text, good, yeah.
So definitely doing lots of reading in public health, reading around. There's lots of books and articles on public health, reading on health promotion, reading on epidemiology, looking at what's in the news. I also have a podcast called Passions in Public Health that you can go look at if you're interested in listening to experts in our field. And just keep being nosy, keep being passionate, and developing your academic writing skills before you come here as well. So learning how to reference. I've put the study skills handbook in the chat as well, so people can have a look at that, and it's only cheap off Amazon, but that will really help you thinking about writing in a particular academic way. I saw there was a question about placements in the chat as well, and I wanted to say the MSc Global Public Health is a really busy course. So you are doing a lot in the year, and we expect you to be autonomous in your learning. So although we teach you in the classroom, we expect you to do lots of reading engagement outside. And Pooja is a really good example. So although we don't have specific placement, we do encourage our students to volunteer, engage with the community, become student ambassadors, but also we really stress to you the importance of focusing on your studies and the theory behind public health, because that's how we make change in this world, is understanding what's gone on before and how we can implement this into practice.
Amazing. Thank you. Thank you so much. I think there are a lot of similar type of questions that students are asking related to admissions. I would say that we'll get back to you with the questions. We'll have the list with us, and then I'll ask my team to reach out to you individually in order to give you more clarity upon if there are gaps accepted in the scholarships, and also the background that you need to have in order to apply for the courses. So I would say thank you everyone for joining in today. If you're not able to answer your questions at this moment, we will surely get back to you. But I think we've covered a lot of great information, and we truly appreciate your participation and engagement. A big thank you to our incredible speakers for sharing their insights. And as I mentioned earlier, this session has been recorded, and you all will receive the recording link shortly. So please feel free to share it with anyone who might be interested in these courses or might be interested to learn more about the same. But thank you all once again for joining in. Before I end, is it something that somebody wants to add that probably you've seen in the question, which I might have missed? Or then we can wrap it up until next time. So I leave it to the panelists once to see if you would love to answer any of the questions that are listed in here. So anyone, it's free to all of you.
Neha, can I
Yes,
just mention our
please.
scholarships,
Yes,
Neha?
yes, please, Richard, go ahead.
Thank you so much. So obviously we displayed on the slides the tuition fee of £17,000 per year. We also offer an international student scholarship of £1,500. So that reduces our tuition fee to £15,500 per year. And the scholarship is applicable for every year of study. So if you're doing a BSc, that's every year for 3 years. If you're doing the MSc Physiotherapy, that's for, both years. That's for the 2 years. So yeah, thanks, Neha. I just wanted to mention our international student scholarship.
Amazing. Thank you. Thank you so much for that. Okay. Any other question the panelists would like to answer before we wrap this up?
I saw one question about community engagement outside the studies. So I want to answer about that you'll get a lot of chance to engage in the community as well. Like I am a student ambassador, I'm volunteering as peer mentor, I am also volunteering as stressless champion, library champion, and I'm also a course rep. So it depends upon person to person. You'll be given a lot of opportunities. It depends on you how you grasp it and how you engage with the community. Yeah.
Well said, Pooja. Yes,
Can I
Nicole.
just
Yes.
add one more As well, at Christ Church in public health, we're really keen to support and publish with our students. So if you look up my name, for example, or many of our team like Gertrude, Tristy, we're really into supporting your research and your career and your interest as well. And hopefully we look forward to meeting some of you in September. It'd be really lovely to have some of you.
Thank you, Nicole. Perfect. Then thank you so much. This was a great session. We're going to be looking forward for all the questions that the students have to be answered separately for those who we've missed. But thank you once again to all the panelists. And yeah, we wrap this session up. See you soon. Take care.